Question 1. A nurse is caring for a client with chronic obstructive pulmonary disease, COPD. Which of the following is the most appropriate breathing technique to teach this client to improve gas exchange? A. Deep diaphragmatic breathing. B. Pursed lip breathing. C. Rapid shallow breathing. D. Valsalva maneuver. Answer: B. Pursed lip breathing. This question tests understanding of breathing techniques for COPD. The keyword improve gas exchange for a client with COPD points to methods that help expel trapped air and keep airways open longer. Pursed lip breathing helps prolong exhalation, which prevents airway collapse and allows for better removal of carbon dioxide, ultimately improving oxygen-carbon dioxide exchange. For example, a nurse would instruct the client to inhale slowly through the nose and exhale slowly through pursed lips, as if whistling, making the exhalation twice as long as inhalation. This technique is crucial for managing dyspnea in COPD. Question 2. A client is admitted with community-acquired pneumonia. The nurse assesses the client and finds a temperature of 102.8 degrees Fahrenheit 39.3 degrees Celsius, productive cough with rust-colored sputum, and crackles in the right lower lobe. Which nursing intervention should be prioritized? A. Administering a prescribed bronchodilator. B. Encouraging increased fluid intake. C. Assisting with ambulation. D. Providing education on smoking cessation. Answer: B. Encouraging increased fluid intake. This question assesses prioritization of nursing interventions for pneumonia, with keywords like temperature of 102.8 degrees Fahrenheit and productive cough with rust-colored sputum indicating infection and potential dehydration. Increased fluid intake is crucial for pneumonia clients as it helps thin respiratory secretions, making them easier to expectorate and improving airway clearance. While other options like bronchodilators or ambulation may be part of the care plan, thinning secretions directly addresses a key symptom and aids in recovery. Think of it this way: thinner secretions are easier to cough up, preventing mucus plugging and further complications. Question 3. A client with a new tracheostomy is experiencing frequent coughing and secretion buildup around the stoma. Which nursing action is most appropriate to maintain airway patency and prevent complications? A. Performing tracheal suctioning every hour. B. Applying a sterile dressing over the stoma. C. Providing humidified oxygen via tracheostomy collar. D. Administering a cough suppressant. Answer: C. Providing humidified oxygen via tracheostomy collar. This question focuses on essential tracheostomy care, particularly for frequent coughing and secretion buildup. The absence of the upper airway's natural humidification means the tracheostomy bypasses the nose and mouth, leading to dry secretions. Providing humidified oxygen via a tracheostomy collar helps moisten the inspired air, preventing secretions from thickening and drying, which reduces irritation, coughing, and makes secretions easier to clear. For example, dry secretions can quickly form a plug and obstruct the airway, so humidification is a primary preventive measure. Always prioritize airway management with a new tracheostomy. Question 4. A nurse is assessing a client admitted with acute asthma exacerbation. Which of the following findings would indicate a worsening condition and require immediate intervention? A. Inspiratory wheezing. B. Respiratory rate of 18 breaths/minute. C. Absence of wheezing with diminished breath sounds. D. Pink and warm skin. Answer: C. Absence of wheezing with diminished breath sounds. This question tests the nurse's ability to recognize critical signs of worsening respiratory distress in asthma. While wheezing is common in asthma, the keyword absence of wheezing with diminished breath sounds is a crucial red flag indicating severe bronchoconstriction and impending respiratory failure, as airflow is so restricted that even wheezing cannot be produced. This signifies a silent chest, a highly ominous sign that requires immediate, aggressive intervention. For example, if a client who was previously wheezing suddenly becomes silent, it's a sign that their airways are almost completely closed, trapping air and preventing movement. Always be vigilant for this critical change. Question 5. A client with a pleural effusion is scheduled for a thoracentesis. The nurse should position the client in which of the following ways? A. Supine with the head of the bed elevated 30 degrees. B. High Fowler's position, leaning forward over a bedside table. C. Prone position with arms extended overhead. D. Trendelenburg position. Answer: B. High Fowler's position, leaning forward over a bedside table. This question addresses proper positioning for a thoracentesis, a procedure to remove fluid from the pleural space. The keyword pleural effusion implies fluid accumulation, and the thoracentesis procedure aims to drain it. Positioning the client in high Fowler's, leaning forward over a bedside table, helps separate the ribs, widens the intercostal spaces, and allows the diaphragm to descend, making it easier to access the fluid pocket and reducing the risk of complications like pneumothorax. This position maximizes lung expansion and the space for needle insertion. Remember that comfort and accessibility are key for such procedures. Question 6. A nurse is reviewing arterial blood gas, ABG, results for a client with respiratory distress, pH 7.28, PaCO 2 58 mm of mercury, HCO3 24 milliequivalent/L, PaO 2 70 mm of mercury. This indicates which acid-base imbalance? A. Metabolic acidosis. B. Respiratory alkalosis. C. Respiratory acidosis. D. Metabolic alkalosis. Answer: C. Respiratory acidosis. This question evaluates the interpretation of arterial blood gas, ABG, values, a fundamental skill. The key findings are a low pH, 7.28, indicating acidosis, and a high PaCO 2, 58 mm of mercury, indicating carbonic acid excess, with a normal HCO3, 24 milliequivalent/L, which together point to respiratory acidosis. This imbalance occurs when the lungs cannot adequately remove carbon dioxide, leading to CO2 retention and increased carbonic acid. For example, a client with COPD exacerbation or pneumonia might present with these ABG values due to impaired gas exchange. When the pH is low and PaCO 2 is high, think respiratory and acidosis. Question 7. A client with a history of deep vein thrombosis, DVT, suddenly develops dyspnea, pleuritic chest pain, and a feeling of apprehension. The nurse should suspect which life-threatening condition? A. Myocardial infarction. B. Pneumothorax. C. Pulmonary embolism. D. Acute bronchitis. Answer: C. Pulmonary embolism. This question tests the recognition of a life-threatening respiratory condition, especially with the keyword history of deep vein thrombosis, DVT, and sudden onset of dyspnea, pleuritic chest pain, and apprehension. These are classic symptoms of a pulmonary embolism, PE, where a blood clot, often from a DVT, travels to the lungs and obstructs pulmonary arterial circulation. A PE is an emergency that requires immediate intervention to prevent severe respiratory and cardiac compromise. Recognizing this classic triad of symptoms in a high-risk client is critical for prompt diagnosis and treatment. Question 8. A nurse is providing discharge teaching for a client with newly diagnosed latent tuberculosis infection, LTBI. Which statement by the client indicates understanding of the teaching? A. I will need to take medication for 6 to 9 months to prevent active disease. B. I am contagious to others even though I don't have symptoms. C. I will need to be hospitalized for airborne isolation. D. I can stop my medication once my cough resolves. Answer: A. I will need to take medication for 6 to 9 months to prevent active disease. This question focuses on education for latent tuberculosis infection, LTBI, with the keyword latent tuberculosis infection implying the absence of active disease and contagiousness. LTBI is treated with antitubercular medications for several months, typically 6 to 9 months, often with isoniazid, to prevent progression to active TB disease, but the client is not contagious and does not require isolation. It's crucial to understand that latent means the bacteria are present but inactive, and treatment is prophylactic. The goal is to prevent the future development of active, contagious disease. Question 9. A client is receiving oxygen therapy via nasal cannula at 5 liters per minute. The nurse notes that the client's nasal mucosa is dry and crusted. Which intervention should the nurse prioritize? A. Increasing the oxygen flow rate. B. Switching to a simple face mask. C. Adding humidification to the oxygen setup. D. Discontinuing oxygen therapy temporarily. Answer: C. Adding humidification to the oxygen setup. This question addresses complications of oxygen therapy via nasal cannula and appropriate interventions. The keyword dry and crusted nasal mucosa directly indicates a need for humidification. Oxygen delivered at higher flow rates, like 5 liters per minute, can be drying to the mucous membranes, leading to discomfort, irritation, and potential breakdown. Adding a humidifier to the oxygen delivery system moistens the oxygen, preventing dryness and promoting client comfort and adherence to therapy. This is a common and important nursing intervention for oxygen therapy. Question 10. A nurse is assessing the chest tube drainage system for a client after a lobectomy. The nurse observes continuous bubbling in the water seal chamber. What is the most appropriate initial action? A. Document the finding as normal. B. Clamp the chest tube immediately. C. Assess the client for respiratory distress and check all connections. D. Increase the suction setting on the chest tube drainage system. Answer: C. Assess the client for respiratory distress and check all connections. This question assesses the nurse's response to an abnormal chest tube finding. The keyword continuous bubbling in the water seal chamber after a lobectomy, lung surgery, is a critical clue. While intermittent bubbling is normal with pneumothorax resolving or with positive pressure ventilation, continuous bubbling often indicates an air leak in the system or from the client. The first step is to assess the client for signs of distress, as their respiratory status is paramount, and then systematically check all connections from the insertion site to the drainage system to identify the source of the leak. Clamping without clear indication can be dangerous. Question 11. A nurse is caring for a client with acute respiratory distress syndrome, ARDS. The client is intubated and mechanically ventilated. Which finding is most indicative of worsening ARDS? A. Improving PaO2 levels with consistent FiO2. B. Decreased crackles on auscultation. C. Increasing bilateral infiltrates on chest X-ray. D. SpO2 95% on 80% FiO2. Answer: C. Increasing bilateral infiltrates on chest X-ray. This question assesses understanding of objective signs of worsening acute respiratory distress syndrome, ARDS. The keyword worsening ARDS points to typical pathological changes. ARDS is characterized by widespread inflammation and fluid accumulation in the alveoli, leading to severe hypoxemia. Increasing bilateral infiltrates on chest X-ray, often described as a whiteout, directly reflects the progressive alveolar fluid accumulation and lung consolidation typical of worsening ARDS. While other options might seem related, this X-ray finding is a direct visual confirmation of the disease's progression. Question 12. A nurse is teaching a client with chronic bronchitis about preventing exacerbations. Which statement should the nurse include in the teaching plan? A. You should get a yearly influenza vaccination. B. Limit your fluid intake to prevent fluid overload. C. Increase your outdoor activity during peak pollution times. D. Avoid seeking medical attention for a cough unless it lasts more than 2 weeks. Answer: A. You should get a yearly influenza vaccination. This question is about preventing exacerbations in chronic bronchitis, a form of COPD. The keyword preventing exacerbations highlights the importance of proactive health measures. Respiratory infections, especially influenza, are common triggers for acute exacerbations in chronic bronchitis, worsening symptoms and lung function. Therefore, yearly influenza vaccination is a crucial preventive measure recommended for all clients with chronic respiratory conditions to reduce the risk of severe illness. Think of it as a vital layer of protection against common triggers. Question 13. The nurse is preparing to administer a beta-adrenergic agonist bronchodilator to a client with asthma. The nurse understands that this medication works by A. Decreasing inflammation in the airways. B. Relaxing bronchial smooth muscles. C. Suppressing the cough reflex. D. Thinning respiratory secretions. Answer: B. Relaxing bronchial smooth muscles. This question tests the mechanism of action of a common respiratory medication. The keywords beta-adrenergic agonist and bronchodilator are key clues. Beta-adrenergic agonists work by stimulating beta-2 receptors in the bronchial smooth muscles, leading to relaxation of these muscles and widening of the airways, bronchodilation. This rapid action helps to relieve bronchospasm and improve airflow in conditions like asthma. For example, albuterol is a common short-acting beta-agonist that provides quick relief. Remember that bronchodilator means it opens the bronchi. Question 14. A client who has undergone a laryngectomy is being discharged. Which long-term complication should the nurse discuss with the client and family regarding speech? A. Permanent voice loss. B. Temporary hoarseness. C. Increased vocal range. D. Reduced need for vocalization. Answer: A. Permanent voice loss. This question focuses on the long-term impact of a laryngectomy, which involves the surgical removal of the larynx, voice box. The keyword laryngectomy directly implies the removal of the structure responsible for voice production. Therefore, a significant long-term complication is permanent voice loss, requiring the client to learn alternative methods of communication such as esophageal speech, electrolarynx, or tracheoesophageal puncture, TEP, speech. It's vital for clients and families to understand this profound change in communication. Question 15. A nurse is caring for a client with a nasal cannula. Which of the following is the highest oxygen flow rate that can be delivered safely and effectively by nasal cannula? A. 2 liters per minute. B. 4 liters per minute. C. 6 liters per minute. D. 10 liters per minute. Answer: C. 6 liters per minute. This question assesses knowledge of safe oxygen delivery limits for a nasal cannula. The keyword highest oxygen flow rate for a nasal cannula is the key. While some sources might mention slightly higher rates, typically, a nasal cannula is effective and safe up to 6 liters per minute. Beyond 6 liters per minute, the effectiveness of increasing VO2, fraction of inspired oxygen, plateaus, and higher flows can become very drying and irritating to the nasal mucosa, leading to discomfort and potential bleeding. For higher oxygen requirements, a different delivery device, such as a simple face mask or non-rebreather mask, would be more appropriate. Question 16. A nurse is teaching a client about home oxygen safety. Which statement by the client indicates a need for further teaching? A. I should keep a no smoking sign near my oxygen. B. I can use petroleum jelly on my lips if they get dry. C. My oxygen tank should be stored upright and secured. D. I need to ensure my smoke detectors are working. Answer: B. I can use petroleum jelly on my lips if they get dry. This question tests critical home oxygen safety knowledge. The keyword need for further teaching signals that the nurse is looking for an incorrect statement. Petroleum jelly, like Vaseline, is oil-based and highly flammable, posing a significant fire risk when used with oxygen. Water-based lubricants are the only safe option for moisturizing lips or nasal passages for clients on oxygen therapy. Always educate clients to avoid oil-based products near oxygen to prevent combustion. Question 17. A client with severe emphysema is experiencing an acute exacerbation. The nurse notes the client is using accessory muscles to breathe, is tachypneic, and has a SpO2 of 88%. Which action should the nurse take first? A. Prepare for endotracheal intubation. B. Administer a prescribed bronchodilator by nebulizer. C. Place the client in a supine position. D. Encourage the client to cough forcefully. Answer: B. Administer a prescribed bronchodilator by nebulizer. This question requires prioritization of interventions for an acute emphysema exacerbation with signs of severe respiratory distress, accessory muscles, tachypneic, SpO2 88%. While intubation might be considered later, the immediate priority is to improve airflow and oxygenation. Administering a prescribed bronchodilator by nebulizer is a rapid and effective way to open airways and improve gas exchange during an acute exacerbation. This action directly addresses the underlying bronchospasm common in COPD exacerbations and provides immediate relief. Question 18. A nurse is assessing a client for tracheal deviation. The nurse understands that tracheal deviation is a potential sign of which condition? A. Pneumonia. B. Bronchitis. C. Tension pneumothorax. D. Asthma exacerbation. Answer: C. Tension pneumothorax. This question assesses knowledge of a critical respiratory assessment finding. The keyword tracheal deviation points to a medical emergency. Tracheal deviation, where the trachea shifts away from the affected side, is a classic and late sign of a tension pneumothorax. In this life-threatening condition, air rapidly accumulates in the pleural space, causing pressure that pushes the mediastinum, including the trachea, heart, and great vessels, to the opposite side. This requires immediate intervention to decompress the chest. Question 19. A client is receiving continuous positive airway pressure, CPAP, at night for sleep apnea. The nurse explains that the primary purpose of CPAP is to A. Increase the oxygen concentration in the room air. B. Provide warm, humidified air to the lungs. C. Maintain a positive pressure in the airways to prevent collapse. D. Deliver intermittent breaths to stimulate breathing. Answer: C. Maintain a positive pressure in the airways to prevent collapse. This question tests understanding of CPAP therapy. The keyword CPAP and the context of sleep apnea are vital clues. CPAP works by delivering a continuous stream of positive pressure air into the airways, acting as a pneumatic splint to keep the upper airway open during sleep, preventing episodes of apnea and hyponia. This constant pressure prevents the soft tissues of the throat from collapsing and obstructing airflow. For example, it's like a gentle air splint for the airway. Question 20. A nurse is caring for a client with a history of aspiration pneumonia. Which nursing intervention is most important to prevent future episodes? A. Elevating the head of the bed during meals and for 30 to 60 minutes afterward. B. Providing all liquids with a straw. C. Encouraging rapid eating to minimize fatigue. D. Offering hard, crunchy foods to stimulate swallowing. Answer: A. Elevating the head of the bed during meals and for 30 to 60 minutes afterward. This question focuses on preventing aspiration pneumonia, with the keywords aspiration pneumonia indicating the entry of foreign material into the lungs. Elevating the head of the bed, Fowler's position, during meals and for a significant period afterward uses gravity to help prevent reflux and keeps food and liquids from entering the trachea, significantly reducing the risk of aspiration. This is a fundamental and highly effective nursing intervention for clients at risk. Question 21. A client with cystic fibrosis receives pancreatic enzyme supplements. The nurse explains that these enzymes are taken to improve the absorption of which of the following? A. Water and electrolytes. B. Proteins, fats, and carbohydrates. C. Vitamins C and B. D. Sodium and potassium. Answer: B. Proteins, fats, and carbohydrates. This question assesses understanding of the treatment for cystic fibrosis, specifically pancreatic enzyme supplements. The keyword cystic fibrosis should immediately bring to mind its impact on the exocrine glands, including the pancreas. In cystic fibrosis, thick mucus blocks the pancreatic ducts, preventing digestive enzymes from reaching the intestines. Pancreatic enzyme supplements are taken to replace these missing enzymes, thereby improving the digestion and absorption of essential macronutrients like proteins, fats, and carbohydrates. This helps prevent malabsorption and malnutrition. Question 22. A nurse is assessing a client with tuberculosis who reports night sweats, fatigue, and weight loss. The nurse understands these are signs of A. Latent tuberculosis infection. B. Active tuberculosis disease. C. Drug-resistant tuberculosis. D. Resolved tuberculosis infection. Answer: B. Active tuberculosis disease. This question tests the recognition of symptoms associated with active tuberculosis. The keywords night sweats, fatigue, and weight loss are classic systemic symptoms of active tuberculosis disease, along with a persistent cough and fever. Unlike latent TB, active TB means the bacteria are multiplying and causing symptoms, making the client contagious. These signs indicate the need for prompt diagnosis and initiation of antitubercular treatment. Question 23. A nurse is educating a client about the use of an incentive spirometer. Which instruction is most appropriate for the client? A. Exhale forcefully into the mouthpiece. B. Inhale deeply and slowly to raise the indicator. C. Perform the exercise rapidly multiple times per hour. D. Use it only when you feel short of breath. Answer: B. Inhale deeply and slowly to raise the indicator. This question focuses on the correct use of an incentive spirometer. The primary purpose of an incentive spirometer is to encourage deep inspiration, which helps expand the lungs and prevent atelectasis, lung collapse. Therefore, the correct instruction is to inhale deeply and slowly to maximize lung expansion and hold the breath for a few seconds to promote alveolar inflation. Exhaling forcefully or rapid use defeats its purpose. Question 24. A nurse is preparing to suction a client with a tracheostomy. Which action is essential to perform before suctioning to prevent hypoxemia? A. Administering a cough suppressant. B. Hyperoxygenating the client. C. Increasing the suction pressure. D. Placing the client in a supine position. Answer: B. Hyperoxygenating the client. This question assesses a critical safety step in tracheostomy suctioning. The keyword prevent hypoxemia highlights the risk of suctioning, which removes oxygen along with secretions. Hyperoxygenating, pre-oxygenating, the client with 100% oxygen for 30 to 60 seconds before inserting the suction catheter helps build an oxygen reserve in the lungs, minimizing the risk of a drop in oxygen saturation during the procedure. This is a fundamental safety practice to prevent complications like dysrhythmias and cardiac arrest. Question 25. A client with newly diagnosed asthma is prescribed a corticosteroid inhaler. The nurse should instruct the client to perform which action after using the inhaler? A. Rinse the mouth with water. B. Immediately take another puff if symptoms persist. C. Hold their breath for 30 seconds. D. Drink a glass of milk. Answer: A. Rinse the mouth with water. This question focuses on proper technique and post-administration care for corticosteroid inhalers. The keyword corticosteroid inhaler is important because these medications can cause oral thrush, candidiasis, and dysphonia, hoarseness. Rinsing the mouth with water and spitting it out after each use helps remove residual medication from the oral cavity and throat, significantly reducing the risk of these local side effects. This simple yet crucial step prevents fungal growth and irritation.